Thanks so much for joining us today on the Roadmap to Medicare. My name is Tracy Kesey, and I am the president and owner of HTA Insurance Services. Here at HTA, we help simplify and solve complex insurance decisions, specifically as it relates to Medicare. And we have a nice comprehensive process. The first is going to be our Medicare onboarding services. That's going to start with your roadmap consultation. This is typically done prior to your 65th birthday or prior to retirement, where we're going to go over your timeline as to when the most appropriate time is to enroll in Medicare and give you an overview of what that process looks like, what it costs, and when we need to start taking action. The next point of contact we'll have with you is your Medicare A and B enrollment. We're going to help you when it's time to enroll in each of these parts of Medicare, providing you guidance and instruction and the forms that you need to do so. And then we will assist in understanding and choosing the plans that are right for you. We're going to listen to your objectives and your budget and your goals, and we will talk to you about the various plan options that are available and help you make your best educated decision on what is meaningful to you. Once you go through our Medicare onboarding services, you're eligible for our VIP ongoing support. This is exclusively available only to those that have gone through our onboarding services. Unfortunately, we just don't have the capacity to help everybody with Medicare questions. We are here to answer any of your questions as related to Medicare benefits and how they work. We help with billing and claims inquiries, and we provide an annual review. So each year when you see those commercials come up on TV that it's time to choose your Medicare Advantage or prescription plan again, we're here to help you with that. You're not alone. So what makes us different? There's not going to be any unwanted phone calls, no pushy sales agents. We're here to be on your team. So we don't do any solicitation. The way we make our connection with people is by being introduced. We're introduced through employers, through financial advisors, through other trusted members of your professional team, or your friends and family. So if you need our help, call us. We're not going to be those hundreds of phone calls you receive. We're not going to be those stacks of mail you receive. We provide unlimited professional support, specializing in Medicare for over 20 years, and we have access to over 35 insurance carriers, so we can really help you make your best educated decision, and we can provide this assistance nationwide. Now, where we're truly unique is the fact that anybody that you talk to in our office is a salaried advisor. So they're not commission-based. They're not getting paid to sell you something. Their job is to provide unbiased advice and support and no pressure to buy, but help you make your best educated decision into the programs that make most sense to you. And guess what? This is a completely complimentary service. It's no cost to you. If you have family or friends that need our help, it's no cost to them. Anybody who needs help onboarding into Medicare, they can call HTA. Again, we're not going to solicit them, but if they want our help, they can call and we will offer it to them at no cost. So you may be thinking, okay, so HTA offers all this service and they're not charging me anything. How does this work? Well, I want to be completely transparent. Our only request, our only ask is that if you found the advisors that you were talking to in our office helpful and friendly and easy to work with, when the time comes for you to enroll in Medicare, because at some point you will need to enroll in Medicare, please allow us to help you. Allow us to fill out the paperwork for you because HTA is paid by the insurance companies to do so. So the good news to you is you don't pay any more for the insurance by enrolling through us. You just get our assistance. If you went directly to the insurance carrier, you would pay the same amount of money as by using our help. So it truly is a no-cost service to you. Okay, so enough of the commercials. Let's dive right in. What is Medicare? Medicare is the health insurance that becomes available to you, your friends, your family, once you turn age 65. You may become eligible earlier than that if you have Social Security disability or any kind of end-stage renal disease, permanent kidney issues. Now, many people don't realize that Medicare actually has nothing to do with normal retirement age. Normal retirement age is the age you are when you become eligible for your full Social Security income benefit, but 65 is the age when you become eligible for Medicare. So at age 65, you have a decision to make. Do I enroll in Medicare like all the literature tells me, or do I have a valid reason to defer my Medicare for later? I would like to first start off by talking about the Medicare benefits and costs. I'd like to give you an understanding of the different parts and pieces, A, B, C, and D, what they cost and what they cover. So that way you have a little bit better of an idea of what to expect in retirement healthcare benefits, what your options are, and what you should prepare for your budget. So when you're choosing your Medicare insurance, you're going to need 4 parts and pieces to make up comprehensive healthcare in retirement. You're going to need original Medicare, which is Medicare A and B, and you enroll through the Social Security Administration for that. Then you're also going to need Medicare C and D, and this is offered by private insurance companies, and HTA can help you find a variety of different insurance companies and plan options to choose from. So you would enroll through HTA on these. When it comes to the C category, there's really 2 choices here. We can do Medicare Advantage, which are the plans that you see advertised on TV as an all-in-one alternative to original Medicare that includes your prescription, your dental, vision, or other services. Or you can do a Medicare Supplement plan, which sits on top of your Medicare, and it's more of an a la carte program where you choose your medical benefits, your prescription benefits, your dental, vision separately, and you would pay for each one individually. Regardless of which one of these options you take, you will be paying your Medicare Part B premiums. They don't stop just because you're going with the alternative option. And the D coverage, that's your drug coverage. So when everything's said and done, you're going to have Medicare A and B, you're going to have some form of Medicare C, and you're going to have D drug coverage. So let's walk through each one of those pieces. When I think of Medicare Part A, I think of A for admission into the hospital. If I am admitted as an inpatient in the hospital, that's going to fall under Medicare Part A. And Medicare Part A does not have a cost, provided either you or your spouse has worked a minimum of 40 quarters, 10 years, and paid Medicare taxes. So A is for hospital, inpatient, and B is for medical, outpatient. So anything that you're not admitted into the hospital for typically falls under Part B. So things like doctors and specialists, labs, x-rays, MRIs, surgeries, chemotherapy, even things that you go to the hospital for but you're not admitted for, like emergency room treatment, or if you're in the hospital under observation, all of that is considered outpatient and falls under Medicare Part B. Now, Medicare Part B does have a cost for everybody. The only people that don't pay for Medicare Part B are some that qualify for Medicaid or state financial assistance. And if that's the case, then the state may help pay your Part B premiums. But everybody else is going to have to pay, and the base premium for 2023 is $164.90 per month per person. Now that premium is based on your income. So if you look here, you'll see that a single individual tax filer earning up to $97,000 a year, or a joint household tax filer earning up to $194,000 a year, that's what's going to fall into the base income bracket of $164.90 per month per person. Now, if you earn a higher income, then you're going to pay more for your Medicare Part B premiums. It doesn't matter who the wage earner is, though. They're going to, if you file your tax return as a household, they're going to look at the joint income between the two of you, regardless of who earned it, and each spouse is going to have the same Medicare Part B premium. So you might be thinking, you know, what income are they looking at? And the income that's going to be reviewed is your modified adjusted gross income. Now, that's a really hard number to find anywhere. You have to do some calculations to get it. So if you're looking to estimate, I would look at your tax return, bottom of the first page, adjusted gross income, and that's a really close estimate of the number that Social Security is going to be looking at when reviewing your premium amount. Now, the thing that seems strange is the tax return that they look at is the tax return from 2 years ago. So if you're applying in 2023, the premium is going to be based on your 2021 income. And why? Well, pretty much because that's the last income tax return that Social Security can be pretty confident they have on file, because you may not have filed for last year yet. So you might be thinking, well, that's not good for me because I earned more 2 years ago when I was actively working. Now that I'm retiring, my income's going down. Am I going to be stuck paying this higher premium? And the answer is yes and no. So it's really up to you. You could do nothing about it. You can just pay the higher premium. And if your income goes down in 2023, Social Security will figure that out in 2025, because every year they do a review of your tax return. So in 2024, it's going to be based on 2022 income, and 2025 will be based on 2023 income. So you could just wait it out, but they're not going to pay you back for the higher premiums that you paid for the past 2 years. But what we generally recommend is that you file an appeal. It's just a form that you fill out, and it gives you the opportunity to talk about your life event where you've reduced your work or you've stopped working, and indicate what you anticipate your income's going to be moving forward. And what they'll do is they'll make a manual adjustment now of your Medicare premiums, and you'll pay the lower amount immediately rather than having to wait 2 years. Now, they will do the review 2 years from now, and if they find out that you underpaid, that your income was actually more than you stated, they will come back and balance bill you. But it may be better than paying more premium than you have to for 2 years if your income's really gone down. So with Medicare A and B, there's some out-of-pocket costs that you would have if you had A and B only. And that's why we always say that it makes sense to do A, B, some form of C and D, rather than just A and B only. So here's an outline of what you would pay if you had nothing but Medicare A and B. You would pay your Part A deductible, which is the per admission hospital deductible of $1,600. If you're in the hospital for an extended period of time, you will start paying daily copays in the hospital. If we look under the Part B, the outpatient services, doctors, specialists, things like that, pretty decent deductible, $226. So you pay the first $226 each calendar year of your outpatient care. And then after that, you pay 20% of the cost. So 20% of the cost isn't so bad. However, the risk is that there's no cap on that out of pocket. So you pay 20% of the $100 bill, but you also pay 20% of the $100,000 bill. In addition, doctors can actually accept Medicare. In fact, like 99%, this is a true statistic, 99% of non-pediatric doctors accept Medicare. Yet, they do not have to accept the Medicare assigned rate for their services. So they can accept Medicare as your insurance, but they can charge more than what Medicare says they're allowed to charge. In fact, they can charge up to 15% over and above the Medicare allowable rate. And of course, Medicare is not going to pay that. So that would be your responsibility. And Medicare doesn't have any benefits built in for foreign travel. So the biggest risk with doing Medicare only is that there's no cap on your out-of-pocket risk. Now, there's also some things that Medicare doesn't cover. So things like dental, routine eye care, hearing aids, fittings, and long-term care, meaning personal needs care, help getting in and out of bed, help getting a shower, things like that. The good news is there's insurance available to pay for those things, but Medicare, original Medicare, does not cover that. Now, one caveat here, I would say when you think of Medicare, think of medical. So when it comes to vision, if you are receiving treatment for cataracts or glaucoma or diabetic eye issues, that's medical, and that would be covered by Medicare. But if it's a routine eye exam, not medical, not covered by Medicare. Same thing as when it goes to long-term care. If you get surgery and need physical therapy or rehab afterward, that's medical. You're receiving skilled treatments, physical, occupational, or speech therapy. But if it's more of a personal needs nature, help dressing, help bathing, getting to and from doctor visits, that's where Medicare takes a step back and says, this is not medical. So we have two options to choose from to couple with Medicare. We can choose Medicare Advantage, also known as Medicare Part C. We can choose Medicare Supplement, also known as Medigap. So Medicare Advantage is the all-in-one alternative to original Medicare. It's going to replace your Medicare A and B card, but you still must pay that Medicare Part B premium. Can't get away from it. The Medicare Supplement is the a la carte program. You pick and choose what you need and you pay for it individually. It's secondary to Medicare, so you're going to carry the Medicare card as well as your supplemental card, and you must pay your Medicare Part B premium. So that's the same for both. So let's compare the differences between Medicare Advantage and Medicare Supplement, because we do find that this confuses a lot of people. The words are so similar that they kind of just get mixed up in your head. So Medicare Advantage are the plans you typically see advertised on TV. And these advertisements start out with some really great benefits. Extras, things like dental, vision, hearing aids, prescription plans, gym membership, Meals on Wheels programs. I can keep going. Over-the-counter benefits. All of these benefits may be included in your plan. So if these are important to you, when we shop for a plan, let's shop for a plan that includes these benefits. Now, of course, some restrictions apply, but there are some pretty quality benefits to be had in there. Now, on the supplement side, these are not the plans you see advertised on TV, and they are more of an a la carte. So they're not going to include dental, vision, hearings, and the extras like gym memberships and stuff like that. Now, some of the plans do have discount programs for this. There's very few plans out there that will do the gym membership. So if that's important, let's talk about it. So if you want these benefits, you're going to buy them separately on the Medicare Supplement plan, but we can probably find a plan where they're included on the Medicare Advantage plan. The next thing is the cost. So premium cost versus the cost of medical care when you need it. So Medicare Advantage plans, not only do they include all those extra benefits, but they're lower in premium. Typically, the premiums are $0 to $150 a month, but I'll tell you, there's so many options out there. You can find many in the $0 premium range up to about $50. Now, a lot of people think, how can you get a free insurance plan? Well, what happens is because this plan is replacing your Medicare A and B, for lack of a better term, what happens is the money that you're sending to the federal government for your Medicare Part B, some, all of that, or even more than that, the federal government is paying the Medicare Advantage company to take over responsibility for you. So they're already getting money from the federal government, so there's not a need to charge you more money for that. And they include the prescription benefits at that cost too. So you could virtually get a Medicare Advantage plan for free. But when you receive your care, you're going to pay more in medical expenses than you may on the Medicare Supplement side. So on the Medicare Supplement side, these premiums are higher. We're talking $100 to $250 per month. You purchase the prescription benefits separately, so that would be an extra cost of maybe $10 to $50 a month. So this is going to cost you more on premiums, but when you receive medical care, the Medicare Supplement is going to have a lower out-of-pocket risk. Many of the popular plans have an out-of-pocket maximum under $300 per year, so much less risk on the medical side. Now let's talk about accessing care. Medicare Advantage plans are going to have a few stipulations. There's going to be networks that you have to adhere to, PPO, HMO, or private fee-for-service. Now, if you're in a concentrated metropolitan area, this might not be a big deal. If you're in a more rural area, or unfortunately, if you live in the state of Maryland, this could be a challenge for you. In addition, Medicare Advantage plans, because they're taking over responsibility for your healthcare needs, these are managed care plans. The insurance company has oversight on your medical care. So you're going to run into prior authorizations, limits on certain services, pre-approvals for certain things, many times making the doctor justify the care he or she wants to provide. Now, on the flip side of that, the Medicare Supplement ones, the ones that cost more money, they don't have network restrictions. And remember, I said about 99% of all non-pediatric doctors accept Medicare. So you should have a full range of doctors to see anywhere in the United States. And there's no managed care. You and your doctor make the most appropriate medical decisions for your care needs. You're not going to run into those prior authorizations or those limitations necessarily. So what you might be thinking is, okay, I'm young, I'm 65, I'm healthy. I love the idea of these extra benefits. I love the idea of the low or no cost premium. It includes my prescription plan. You know what? The networks aren't too much of a concern for me. I live in a pretty, maybe a greater Philadelphia area, an area that has a lot of doctor network selection. And the managed care isn't too big of a deal because I'm not getting a lot of medical care. Why don't I go with this Medicare Advantage plan right now And then if something happens to my health later, I'll move to a Medicare supplement. At that point, I'll be willing to pay more for the premium to get that lower out-of-pocket expense, the no networks, and the no managed care. Well, that sounds like a fantastic idea. Unfortunately, in practice, many times it's not a reality. So what happens is when you first become eligible for Medicare, when you first enroll in Medicare B, that's when you can get either types of these plans, no questions asked. And on the Medicare Advantage side, you can continue year over year. Every year you'll have an annual enrollment period to get into a Medicare Advantage plan or change your Medicare Advantage plan, no questions asked. It's on the supplement side that it's a bit more tricky. After you've been in Medicare for 6 months, most states will require you to go through underwriting to either change your Medicare supplement or get into a Medicare supplement. So if you're on the Medicare Advantage side and you get a diagnosis that you now want to move to Medicare supplement, that may prevent you, that diagnosis may prevent you from moving over. So it's something that you definitely want to take into consideration when you first enroll in Medicare and see what direction you're leaning more toward. So let's walk through a little bit more specifically how each of these plans work so you can get a better feel for the benefits. So Medicare Advantage plans, it's kind of like a menu of services. So you see a bunch of services listed down the left side, and this is just a very small screenshot of the huge list of services that they mention. But you can see this is 3 different plans. It shows you doctor copays, emergency room copays, hospital copays. And what's going to happen is you're going to pay these copays whenever you need a service. And if you get sick and need a lot of services, you're going to continue to pay whatever the stated copay is for the service until you reach your maximum out-of-pocket. And these maximum out-of-pockets are going to vary by plan, anywhere from normally about $3,500 to about $8,300. Prescription costs are not going to count towards that maximum out-of-pocket either. So the maximum out-of-pocket's just on medical care. And one thing that I do want to mention is the chemotherapy benefit. So on almost every plan I have looked at, chemotherapy has a 20% copay. So if you were to get a cancer diagnosis and you are on a Medicare Advantage plan, you're going to hit your maximum out-of-pocket. Between chemotherapy, doctor visits, surgery, radiation, you will be hitting your maximum out-of-pocket on the plan. Just to give you an idea on premium, there's a couple here for $0 a month. This one's $45 a month, so very inexpensive on the premium side. And as mentioned, these plans include extras. So Part D, drug benefits, these are included in the Medicare Advantage plan. In fact, you have to take the plan that's included with Medicare Advantage. You cannot purchase a separate prescription plan if you're in Medicare Advantage. Also, dental, vision, if this is important, let's talk about it because many plans offer this. Not every plan and the benefits are different. So you can see here we put some typical benefit ranges on these slides. Gym memberships typically included. Over-the-counter benefits where they give you so much money every quarter on a debit card or through a website where you could buy things like Band-Aids and vitamins. Maybe a grocery allowance depending on your diagnosis. Or even money towards the Part B. So your plan could be free and they could give you money each month to even help compensate for that Part B premium that you're paying to help lower that as well. So depending on what's most important to you, that's how we shop the plan. Now let's talk about how Medicare supplements work. So this doesn't replace Medicare, this supplements Medicare. So I have on the screen the out-of-pocket expenses if you were to have Medicare A and B only. And if we look here, here are the 4 most widely purchased Medicare supplement plans. Plan F and G are the most comprehensive plans. They are the only 2 plans where if your doctor charges excess charges, which is legal in 43 states in the United States, if the doctor charges excess charges, they're not your responsibility if you have Plan F or G. If you look down the column here of Plan F, you see that you would pay $0 for everything. Your maximum out-of-pocket is $0. You pay no copays, no deductibles, no coinsurance. You don't pay for your Medicare eligible services. Plan G is just one step down from that. You have a small deductible of $226 per calendar year. You pay the first $226 of your outpatient expenses. Your maximum out-of-pocket for the year is $226 on Medicare eligible services. After that, all Medicare eligible services are covered at 100%. Now there's 2 other lower cost options available. that do give you some more responsibility here. And if you're looking to save premium dollars, those may be worth looking into. And just to give you an idea on the premiums, now this is for a greater metropolitan area, mid-Atlantic, maybe Philly, Baltimore, DC, New Jersey. If you live in a more rural area, your premiums will be lower. If you live in Minnesota, New York, Massachusetts, Florida, those premiums tend to be higher. Now, one thing I should mention is the Plan F plan is not going to be available to you if you turn 65 or became Medicare eligible after January 1st, 2020. So for many people entering retirement now, this Plan G is the lowest out-of-pocket plan available to you. Shopping for Medicare supplement plans is pretty easy because the benefits are the same with every carrier. If you do Plan G, that $226 maximum out-of-pocket is going to be the same with any carrier you go with. Remember, there's no network restrictions. So when you go to get doctor care, you don't say, do you accept my Aetna or my Cigna or my United Healthcare? You say, do you accept Medicare? And as long as they're one of the 99% that do, you don't have to worry about what supplement you have. And then lastly, there's no claims differentiation on these plans either because Medicare makes all the claims decisions. The supplements are just required to follow the guidance that is provided to them by the federal government Medicare program. So what we're really shopping is price and company reputation. So if you provide us your zip code, your age, and your gender, your tobacco status, we can plug this information into the system and we can tell you what carriers cost which prices so you can make your best educated decision. Now, extras with Medicare supplements can be a bit more limited. Your Part D benefits, your drug benefits, are going to have to be purchased separately. They don't come with the Medicare Advantage plan. So that comes along with an extra premium of maybe about $10 to $50 per month. And these other coverages here may need to be purchased separately. Dental and vision, there may be some discounts available in certain Medicare supplement plans, but no true benefits. So if you want a dental or vision plan, you would purchase them separately at an additional premium. Gym memberships, very limited options to gym memberships on Medicare supplement plans, but we can find you some if that is of interest to you. We can do that. Over-the-counter benefits, money towards Part B and grocery allowance, that's just not an option, unfortunately, with Medicare supplement. So let's summarize pros and cons of Medicare Advantage versus Medicare supplements, kind of help you identify what might make most sense to you. So the pros of a Medicare Advantage plan: low monthly premiums, all those additional benefits that may be included. It's an all-in-one plan, so you only have one ID card. Many plans to choose from, and you can shop annually with no medical questions. Now the cons: the higher out-of-pocket maximum risk, the doctor network restrictions, and many times these are regionally based, so if you travel, that could be a concern. The managed care piece with the prior authorizations and the pre-approvals, and that if you decide you want to go to Medicare supplement later, it may be difficult with medical underwriting. Now on the Medicare supplement side, the pros: low out-of-pocket costs, no doctor network restrictions, nationwide coverage. If you travel, this is a very flexible option. There's no managed care. You and your doctor make your medical decisions. They give some benefits for foreign travel emergency. And these plans are standardized and easy to understand because they follow original Medicare. Now the cons, most of them revolve around cost. You're going to have the higher monthly premium. If you want the extra benefits, you have to buy them for more premium. So again, higher cost. And many times these plans will take an annual rate increase of about 2 to 10% per year. So again, cost. And you have the inconvenience of carrying 3 ID cards: your Medicare supplement and your prescription card in your wallet rather than the all-in-one card. So if you want to pay more money for lower out-of-pocket risk and more flexibility, Medicare supplement may be the way to go. If you're looking to save money on premiums and you're okay with doctor networks and managed care and you want some of those extra benefits included in your plan, then Medicare Advantage may be the way to go. But we can talk to you about that individually and help narrow it down to just a few plans for you to consider. So last thing that we're going to talk about here is the Part D, the drug benefit. So if you have a Medicare Advantage plan, you purchase the medical plan that includes the drug benefits. And if you have a Medicare supplement plan, you would purchase the drug benefits separately. So lots of things to consider here. Deductibles and copays vary by plan. Plan covers different medications. So some medications are covered under one plan, but not another. But every plan is required to cover medications in every prescription category. So there should always be options. And the plans may rank the medications in different tiers. So what might be a tier 1 with one carrier might be a tier 2 for a higher copay with another carrier. Now, if you do a standalone plan with a Medicare supplement, the federal government will tell you the average premium is about $31.50 a month. However, we do have a number of clients that are on plans for $9, $10, $11, $12 a month that they feel provides very adequate coverage for their medication needs. So what do we need to look into this plan? We need the list of meds, including the dosage and frequency that you're taking, and the name of the pharmacy that you like to shop at. And we put all this information into a reporting system, and what we can provide you with is a report showing not only what plan is going to be the lowest overall cost, the premium that you pay for the plan, and what you pay for your prescriptions at the pharmacy. They add that all up over the course of the year to figure out what's the lowest cost for you. But then it also outlines each of your prescriptions and what you can expect month to month in the pharmacy when you go to fill them. And of course, we are here to provide an annual review for you every year. During that annual enrollment time from October through December, when you're supposed to shop your Medicare Advantage and prescription plans, we offer webinars, we send out email reminders, and you'll have the option to reach out to us as part of your ongoing VIP support service to do that annual review. And we can provide you our analysis either via email, or we can schedule a phone or a Zoom meeting to review that with you. Regardless of if you get your prescription plan included in your Medicare Advantage program, or if you purchase it separately as a standalone plan, the plan will have 4 stages of coverage. So the way these plans work is you're always going to start in stage 1, which is the deductible stage. And deductibles can be up to $505, but many plans will waive the deductible for tier 1 and tier 2 prescriptions. Some plans don't have a deductible at all. But if you're in your deductible, you're going to pay the total retail drug cost for those drugs until the deductible is satisfied. Once it's satisfied, you're going to go into stage 2, which is called before gap. And when you're in your before gap stage, you're going to either pay a stated copay like $0 or $5, or you might pay a coinsurance like 27% for your prescription costs. Once your total retail cost, so that's what you pay plus what the insurance company pays, reaches $4,660. So you have some more expensive drugs, or you have many drugs that you're filling that add up to this amount. Then you go into stage 3, which is called your coverage gap stage. It used to be called a donut hole. And during that time, you're going to pay 25% of the cost of any of your prescriptions. If you ever reach $7,400 in total cost, then you're going to go into your 4th and final stage, which is the after gap stage. And that's when you're only going to pay 5% of the cost of your drugs for the balance of the calendar year. Now, there is no maximum out of pocket on this currently as it stands. But the Inflation Reduction Act was just signed into law, and over the course of the next couple of years, these Medicare prescription plans are going to have some more cost stabilization. And one of the things that they've pushed for is to have a maximum out-of-pocket cap on prescription plans around $2,000 a year by year 2026. So the last thing to talk about with drug plans is the Part D drug IRMA, income rated monthly adjusted amount. Basically, it's an income surcharge on your drug plan. So what's going to happen is if you're in the base income bracket, you're going to pay whatever the insurance company charges in premium. But if you're in a higher income bracket, you're going to pay the insurance premium plus an additional monthly fee to the Social Security Administration. So let's take a look and see what you can expect in costs for Medicare. So this example is for people in the base income bracket. We're looking at Medicare Part A at $0, Part B at $164.90. If you choose a supplement, Plan G in this example with a $226 out-of-pocket expense, you're maybe looking in the ballpark of $145. A Medicare Advantage plan, higher maximum out-of-pocket, but lower premium, many of them $0. On the Medigap side, Medicare Supplement side, we have to add a prescription plan. On the Advantage side, we don't have to add a prescription plan, it's included. So if we add all that together, supplement in Medicare, you're probably talking in the low 300s. versus an Advantage plan can be as low as the base Medicare rate, $165 in round numbers. So approximately $165 to $350 a month, depending on how you design your program. Now for each income bracket, you can estimate about $100 more per month per income bracket. So if we toggle all the way up to the highest income bracket, we can see here that the insurance prices didn't change, but the Medicare Part B rate went up. Now we have a surcharge on the drug plan. So here we're looking more in the line of $640 to $850, depending on how you design your program. Now that you know a little bit more about Medicare and how it works, let's talk about when you do and do not have to enroll in Medicare. And this is where we truly feel like we can be so helpful to you, because we help cut through all that Medicare confusion. As you approach your 65th birthday, it's actually called T65. It's when people are 64 and a half. You get put on all kinds of marketing lists, and you're going to get tons and tons of phone calls and tons of mail. And they all say things like deadlines, penalties, must enroll. And you may be thinking, do I really have to go on Medicare when I turn 65? What if I'm not going to retire yet? And maybe you're wondering, can I defer my Medicare A and or B? And what are my Medicare options? So that's where we request, please reach out to us around 64 before you turn 65. We'll help walk you through all that confusion so you don't have to pay attention to the stacks of solicitations that you'll get. And we'll let you know what to expect moving forward, as well as your timeline. So is Medicare automatic? And that's really going to depend. It's going to depend on if you're collecting Social Security before you turn 65. If so, then Medicare is automatic. So maybe you're a stay-at-home spouse and it made sense for you to start collecting Social Security at age 62. Well, in that case, you're going to automatically be enrolled in Medicare when you turn 65. And if you find out that you have a valid reason to defer it, then you can always return the Part B so you don't have to pay for it. But you will remain enrolled in Part A, which is the free part of Medicare. Now, if you're not collecting Social Security income, you will not be automatically enrolled. If you want to enroll in A and or B, you would have to take action. So if you find out that you have a valid reason to defer, simply do nothing. Don't enroll. By not enrolling, you have deferred by default. But do your research first, because the consequences can be steep if you were supposed to enroll and didn't. In fact, you could get penalties. Part B and D penalties can be somewhat steep over time. There could be gaps in coverage. Some types of plans require Medicare to become your primary insurance when you turn 65. And depending on your situation, there's going to be certain enrollment periods that you have to adhere to. And if not, you'll only get one time of year thereafter that you'll be able to enroll. Thing that we need to determine when deciding whether or not we can defer Medicare at age 65 is whether or not we have credible coverage. So credible coverage is group health insurance, and it's based on current active employment. So if I'm currently working and I'm covered under my current employer's group health plan, I have credible coverage. But for dependent spouses, maybe I am working and my dependent spouse is covered under my group health plan. Regardless of if he or she is working, they too have credible coverage because I'm the primary insured and I'm actively employed, and they are covered under my active employment group health coverage plan. So we would both have credible coverage in that respect. So what's not credible coverage? Things like individual insurance, ACA, Obamacare, or group plans that are not based on active employment. So maybe COBRA, retiree, or severance benefits. So let's talk about credible coverage as it pertains to deadlines and penalties. So if you have credible coverage, group health insurance based on active employment, will you receive a penalty if you don't enroll? And the answer is no. You'll not receive a late enrollment penalty because you have credible coverage that's based on your active employment or your spouse's active employment. Now, what you see on the screen here is a screenshot from a roadmap web page that we offer. So if you call our office and ask for advice, after the call and doing some fact finding, we will send you a web page that specifically speaks to your situation. So we have maybe 20 different web pages created for various circumstances, but it's going to look like this. You're going to have a question with a short answer. Now, if you're a researcher and you like to know where those answers come from, you can just click on the little plus sign here, And what's going to happen is all of the details are going to pop up from what we sourced to get those answers, including links that go directly to the Social Security and Medicare web pages, so you can read it from us and you can read it from them. And that's, of course, after we talk you through it over the phone or through a Zoom meeting. So no penalty with credible coverage. And what is the deadline to enroll? So you can enroll anytime you want after age 65, up to 8 months after your group coverage or the employment that it's based on ends. So if you stop working or come off the group coverage, that's when it's no longer credible and your deadline starts ticking to enroll for that 8 months. Now, we know that Medicare is going to let you in anytime after age 65 if you have that credible coverage, but you do have to confirm what are the valid times to come off my group health plan. So some givens are if you turn 65, that's a valid time to opt out of group health insurance. If your open enrollment period for your medical plan is coming due, you can opt out during that open enrollment time. And of course, retirement, when you're leaving the company, that's another time that you can get into Medicare. But maybe it's just any time you decide to enroll in Medicare. So ask your human resources department, is enrollment in Medicare considered a valid reason to opt out of group insurance mid-year? And if they say yes to that, which many employer plans do, then that means that once you turn 65, you have the option to get into Medicare, or anytime you want thereafter, you can decide to get into Medicare. So we know that you won't have penalties or deadlines if you have credible coverage, but there's actually two types of credible coverage, and that's going to depend on the size of your company. So if you're actively employed with group coverage and your company is over 20 employees, you don't need to enroll in Medicare. But if you're actively employed on group coverage and your group is under 20 employees, you still may need to enroll in Medicare, even though there's no penalties and deadlines. Let's take a look. So for companies of over 20 employees, the question is, do I need Medicare to have full coverage? And the answer is simple, it's no. As long as you continue working or your primary insured continues working, that group coverage that you're on is going to remain primary to Medicare, even if you enroll in Medicare. So the only reason that you may want to go into Medicare is if you think you want to come off of your group insurance. Most people don't find it cost effective to add Medicare as secondary to their existing group plan, assuming that they're relatively content with their group plan. So really your choice is, do I stick with my group insurance and not do Medicare? Or do I go into all parts of Medicare and think about coming off of my group insurance? So how do we determine that? Does it ever make sense to come off of group insurance while you're still working and go into Medicare? And that's really going to depend on your group health benefits and the costs. So what you want to look at is the premium that's being drafted out of your paycheck each week or each biweekly. You want to add that up over the course of the entire year. What are you paying in premium in a 12-month period? And then you want to look at your out-of-pocket expenses on the group health plan. So things like co-pays and deductibles and co-insurances. Are you regularly having co-pays at doctor's appointments? Are you hitting your deductibles and your maximum out-of-pocket? Do you have any health needs that are coming up in the future that may cause you to spend more on your group health plan? Add up all of those anticipated medical costs on your group plan. And then what we're going to do, this is just a real quick rule of thumb. If you think your group plan, the cost of the medical and the premium is lower than about $3,600 per year, then your group health plan is probably more cost effective and you can remain on that feeling good that you have the best value right now. But if your group costs are higher than $3,600 a year, or if something comes up with your medical and they become higher than $3,600 a year, well, that's when Medicare may be more cost effective. And I'm not saying just jump off and go into Medicare. I'm saying let's have a more detailed conversation about what Medicare looks like for you and what it costs. And just bear in mind that dependent spouses on the group health plans many times pay a higher premium than the employee does. So it always makes sense to look at your dependent spouse on the group plan when he or she becomes 65 and do this analysis for them as well. So if you have group health insurance, of a company larger than 20 employees, there's really no reason that you need to take Medicare when you turn 65, although it's your choice. So let's assume that you decide you don't want to do Medicare at 65. Do you defer both parts A and B, or do you just defer Part B only, the part that you pay for? And a lot of people are going to tell you that you have to enroll in Part A. Part A is free for many people as long as they've paid their Medicare taxes. And your friends and family probably are going to say you have to take the free part, but you can defer the part that you pay for, the Part B. Well, that's not true. You can enroll in Part A at any time after age 65 without penalty or deadline, as long as you qualify for it for free, meaning you've paid your Medicare taxes. So you're not required to enroll in Part A at age 65. However, it typically makes sense. You know, even if you're going to defer Medicare for now, take the free Part A. It's not going to cost you anything. It's going to sit behind your health insurance plan, so it's not going to provide you a lot of benefit either, but it doesn't cost anything, so why not? And it will get you established in the Medicare system, so when you go to retire later, or maybe you have to make a quick exit from your job, the rest of the Medicare enrollment process will be that much quicker and easier because you've already established your Medicare number with Part A. So many times, if you're going to defer, it still makes sense to enroll in Part A, unless you have a high deductible health plan with a health savings account. Now, I'm not talking about a flexible spending account. I'm talking about a health savings account. Once you enroll in Medicare, even the free Part A, it's going to disqualify you from making deposits into that health savings account. So if you want to stay on your health savings account and continue to fund it while you're working, at that point, we would recommend that you defer both Parts A and B so you can continue to fund your HSA account. And why not? Because you'll be able to use those funds tax-free to pay for your Medicare premiums later and pay for your medical out-of-pocket expenses later as well. So it's a great way to save for retirement health care. You'll always be able to use the funds once you're in Medicare. You just can't deposit more funds into it. So to summarize, if you have credible coverage, active employment, and group health insurance, and you have more than 20 employees in your group, you're not required to enroll in Medicare at this time. Since you have credible coverage, you're not required to enroll in Medicare at this time. However, if you do not have a health savings account, we recommend that you enroll in Part A and only defer your Part B. Now, if you were in an HSA, we would send you a different roadmap webpage that would address deferring both Parts A and B and why, but this is for somebody who's not in a health savings account. Okay, so let's say we deferred. And now we're 68 years old and we're getting ready to enroll in Medicare. When we deferred back at age 65, we didn't have to tell Medicare or Social Security why we were deferring. We didn't have to show proof of credible coverage. But now, when we're getting ready to apply, now's the time to show proof of credible coverage. And it's through this form. It's called a Request for Employment Information form. And we will provide this form to you so you can fill it out and take it to your HR team. You're going to want to take it to your HR team to complete and sign, and you need one for each spouse. So you see number 4 and 6 here. The employee's name goes here, and the applicant's name goes right above it. And the applicant could be the employee themselves, or it could be their dependent spouse. And it asks 2 questions. Give the dates the applicant's coverage began and ended, and also give the dates the employee worked for the company. So basically, they're asking credible coverage questions. Are you actively employed and have you been covered? And they want to see that this trend has continued. It's been continuous with no gaps in coverage since your 65th birthday. So if you've had multiple employers after age 65, you may have to get multiple forms to show that timeline of coverage since your 65th birthday. So now let's talk about the other type of credible coverage that's under 20 employees. So there's only one difference here, and it's the Medicare primary role. So this is actively at work, covered under the group coverage, less than 20 employees. Do I need to have Medicare to have full coverage? Yes, likely. The Medicare law says that if you're in this size group, once you become age 65, Medicare is required to be primary payer, and the group health insurance moves to secondary payer. So because of that, even if you want to keep your group health insurance plan, you're going to need Medicare A and B as primary. So your choice is keep the group health plan as secondary and enroll in Medicare Part A and B to add to it, or enroll in all parts of Medicare and drop the group health plan. So you'll have a choice there as well. So let's say you come to me and say that you love your group health plan, you're in a smaller group size, and you really don't want to enroll in Medicare. Do I have to? Well, remember, because it's group health insurance based on active employment, you're not going to get penalties or have deadlines. So if your plan can agree to pay primary, then maybe you don't need Medicare. So we've drafted a list of questions that show up on that roadmap webpage if you were under 20 employees that say, here are some questions you want to ask your employer or ask the plan administrator to find out, do I really need Medicare? And if you wish to defer enrollment in Medicare A and B, we always recommend that you get that in writing. You don't want to find out that somebody told you wrong information when you have a $100,000 claim. So if we're not saying it's out of the question, some carriers, maybe about 5% of carriers can make exceptions for this, but it's not the norm. Okay, so if you're under 20 employees, should you consider enrolling in Medicare? Most plans are going to require that you have Medicare A and B. So even if you want to keep the plan, you're going to have the added expense of A and B. So the cost of A and B is kind of out of the mix when we're comparing here. What we're looking at is the group health insurance versus the other parts of Medicare, the secondary parts of Medicare that you could use to replace the group health insurance. So if group health costs lower than about $2,400 premiums, deductibles, copays, then keep your group health plan as secondary and just add the Medicare A and B. But if group costs are higher than $2,400, you may want to consider getting out of your group plan entirely, do the A and B, but do the supplement and prescription plan or the C and D through Medicare as well. And again, always check on the cost of the dependents because sometimes their cost is more expensive. So if you have a dependent spouse on the plan, and you are the primary insured, the employee, your choice to opt out of your group health plan and go into Medicare is also contingent on your spouse. Will they have access to other benefits? We don't want you to opt out and find out they have to do COBRA, which is not an attractive price, or go out on a plan on their own if they're not yet Medicare eligible age. So those are things we also like to talk through with you before making a recommendation of enrolling or deferring Medicare. So we've reviewed the credible coverage. Now let's take a look at non-credible coverage. Non-credible coverage would be things like individual insurance, like ACA or Obamacare, or group insurance not based on active employment, like COBRA, retiree, or severance. Now with those type plans, will I receive a penalty if I don't enroll in Medicare? Yes, absolutely. Will Medicare be my primary insurance? Yes. Now this isn't a total absolutely. Some COBRA, retiree, or severance will remain primary. That's up to the plan administrator in the plan documents, but about 95% of them will move to a secondary payer position. And even if they don't, you want Medicare because you don't want to accrue a penalty and you don't want to miss any important deadlines. So if you have any of these type coverage, your choice is, do I keep my current health plan as secondary and add the Medicare A and B as primary? Or do I enroll in all parts of Medicare and just get rid of whatever I have currently? So when to enroll here, your deadline is going to be based on your age when you went on the non-credible coverage. So if you're already on non-credible coverage before you turn 65, like you retired early and went on an individual plan, COBRA, retiree, or severance, and then you turn 65, you're going to have an initial enrollment period, which is 3 months before your birthday, the month of your birthday, and 3 months after your 65th birthday month. Now, if you're getting on non-credible coverage after age 65, example, you retire and you're over 65 and your employer offers you COBRA, retiree, or severance coverage, then you're going to have a special enrollment period. It's going to kind of fit in that same category as the other one. You have 8 months to get into Medicare A and B, and then you're going to decide, do I keep the COBRA, retiree, and severance as secondary, or do I choose all the parts of Medicare at this time? Just to recap, I know that was a ton of information, but let's simplify it nice and easy. Am I required to enroll in Medicare A and B? If you have credible coverage with more than 20 employees, no. If you have credible coverage with less than 20 employees, maybe, probably, because of the primary payer. If you're on non-credible coverage, yes, you need to enroll in Medicare A and B as soon as you get on non-credible coverage or turn 65. So we talked a lot about if you need to, when you need to take action, but now let's talk about how to take action. And I don't want to get into all the nitty-gritty details. You know, sometimes this stuff changes. It's kind of liquid, especially as COVID happened. All these directions kind of changed several different times. But what I want you to know is that we offer detailed instructions, videos, links on exactly either deferring, how you defer in both Part A and B, deferring in B only, or on enrollment, how to enroll at 65, after 65, if you're enrolling in Part A or you're enrolling in Part B only. Believe it or not, these are all different instructions. So we've created a web page for each. We'll help you determine what your best deferring or enrollment strategy is and send you those specific instructions and walk you through them. Thank you for taking the time out of your busy schedule today to learn a little bit more about Medicare. We would love the opportunity to talk to you. There's many convenient ways to schedule with us. You can either go online to www.hta-insurance.com/schedule. You can take a picture or scan the QR code that's on the screen here, which will take you directly to our scheduling page. Or you can call or email our office with any questions or to schedule. So I appreciate your time on the webinar today. When you click out of this webinar, a survey should pop up. If you would kindly answer the survey, it helps us know on what you think we did well and what we need to improve on. Also, if you put any questions in the chat box, we will be answering them via email within 24 hours. I will leave the chat box open for about 3 more minutes. So if you have any last minute items you want to get in there, otherwise you can just reach out to us directly and we're happy to answer those questions as well. Thanks so much. Take care.